Hi, everybody. Thank you so much for joining us on our recorded presentation. We will be talking to you about mental health essentials for young adults. We would really like to thank our sponsor, Hopkinton Youth and Family Services. They're an amazing service that provides individual, group, and family counseling, parent consultation, crisis intervention, information referral, advocacy, community education, programs and activities, youth substance use prevention, and mental health promotion. So thank you so much for sponsoring us. My name is Carrie Prisco. I am a teacher trainer for Mental Health Collaborative, and I will be presenting with Elizabeth, who will introduce herself.
Hi, everyone. My name is Elizabeth Schuster. I'm also a trainer for Mental Health Collaborative, and I have a few years of experience working with young adults, including college students and high school students in various aspects of the mental health field. So first of all, we're going to be talking about the objectives that we'll be covering this evening. By the end of this evening's recording, you will have learned strategies for healthy coping and self-care, how to recognize the signs and the symptoms of mental illness, when to get professional help, how to develop healthy relationships, how to manage transitions during this specific stage of your life, and how to design a fulfilling life as you move into independence, and much more. So first of all, we always start off with the question, what exactly is mental health literacy? We do a really good job of teaching different types of literacy in this country, reading literacy, math literacy, there's even financial literacy, but we don't really do a good job of teaching mental health literacy. So we're going to be diving deeper into that this evening. We've broken it down into 4 basic components, which we'll continue to refer back to this evening as we go through the presentation. So the first one is decreasing stigma. We really want people to understand what mental illness is. We want to dispel the myths, and we want to be able to use the correct language in talking about mental health. The second one, understand and identify mental illness and their treatments and what's available, having a general idea of what the symptoms are and what treatments are available. The third component, understand how to obtain and maintain good mental health promotion, self-care, coping strategies, self-resilience, things like that. And then the fourth one is enhance help-seeking efficacy. So knowing when, where, and how to get help. So why do we do this? Why do we need mental health literacy? So this slide will kind of show you how we parse it out. So the bottom, mental health literacy, is kind of the basis of your knowledge. And we work up into health promotion and prevention, and then treatments and care. If we don't have the base of that literacy in place, it's really hard to then move up and talk about health promotion, the prevention, and then what treatments and care look like. So we're really focusing on the base of what mental health literacy is. A couple key points. This kind of drives home some really good basic statistics for people to understand. 75% of lifetime cases of mental illness begin by the age of 25. At any given time, 20% of the population is affected by mental illness. And right now, there's an average delay between onset of symptoms and intervention of 8 to 11 years. So we really want to work on reducing the average delay between onset of symptoms and the interventions. Most people experience good outcomes with treatments. That's the basis of what we're trying to talk about this evening. Another factor, early identification and treatment is incredibly critical. The language that we use matters. The words that we use to describe things, everything that we are using to describe anything pertaining to mental health, it really is incredibly important. And the overall reducing stigma matters. Even having this online webinar, this is really important in reducing the stigma, which Carrie's going to be talking a little bit more about that.
So now that we've given you an overview, we're going to get into the 4 components, starting with stigma. So let's talk about the language and the words we use when we're talking about mental health. It's confusing. We talk about diabetes or a heart condition or other medical disorders. We have certain words that we use, but for some reason, when we talk about mental health states and mental illness, we throw a lot of different words around, and we're not always very clear with our language. It could be rooted in stigma or just lack of knowledge, but for whatever reason, we tend to use the wrong words and talk in a coded way. So we say things like, I'm so OCD, when we're just really organized. So we pathologize kind of normal things like being organized. And this can be really hurtful and dismissive also to people that actually are diagnosed with the illness of OCD. So it's important to be careful with our language. So this is the MHL pyramid. So it's the mental health literacy pyramid. And this is probably the kind of best tool to describe the different levels of mental health. And it really helps you just to understand the differences between each. So we're going to talk about the first one. So the first level is no distress, problem, or disorder. Basically, you're saying, I'm okay, everything's going well. It's just normal day-to-day, regular stuff. So you're not stressed, no distress. I'm good, things are okay. And then we come to the next level of mental distress. This is feeling stressed. Might have a lot going on. This is something like, for instance, if you lost your keys or you broke something or spilled something, or you're just having a really frustrating day. It's unpleasant, but it does go away on its own. So that's the level of mental distress. And Elizabeth, you can always add anything you need to also. And then the next level is mental health problem. This has been tough. I experienced really hard times. This could be a divorce, a breakup, losing a pet, losing a person, and you're experiencing grief. It usually does last longer than mental distress, but you can, with the support of family and friends, and sometimes a therapist, it will help. It will help the situation. And then the last is the mental illness or disorder. That's 20% of people requires treatment, and it's disease of the brain. This affects 20% of people, like at the population at a given time. And it does require treatment. This is something that you would need treatment for. It's just also important to understand that you can have all these things at the same time. And if you are receiving support and you are getting therapy or medicine or whatever you need, it's you still have a normal, good life. It's just that it's good to be educated on these different levels.
Absolutely. And I would also add, sometimes people have asked me, if I have a mental health problem, does that mean that it could develop into a mental illness or a mental disorder? And I explain to people, it doesn't kind of move up the pyramid in that kind of a way. We're just using this as an illustration. And just as Carrie said, you could be diagnosed with a mental illness, a mental disorder, and yet with the right therapy, medication, you could really be at the base of the pyramid and say, hey, I'm not in any distress right now. I'm really leading a good quality life. And that's one of our goals with this.
Right. So you can be in more than one state at a time. You could have bipolar disorder, may go through a bad breakup at the same time, but also having coffee with your friends and enjoying. And it is important too that everybody's different. Somebody may think mental distress is, if you take the example of, say, COVID or being quarantined, somebody might take that as just stress, and another person might take that as a mental health problem. So,
Mhm.
you know, they're different depending on the person. So how can I tell if this is a mental illness? So we're going to be talking about mental illness versus mental problems or mental distress. So how do we know? Signs versus symptoms of mental illness. Like if you think about signs, it's what's on the outside. Signs would be like crying, spending a lot of time in bed. And then symptoms would be the internal feelings, feeling hopeless, worthless, something like that. It's important to know that someone may have no signs, but a lot of symptoms. So that's just important to think about. Is this getting in the way of school, work, or relationships? Is your mental problem or mental illness really getting in the way of your life? So it's important to think about. And also the length of time. Have we had one bad day, or is it weeks, months, or even years? Other factors are important to keep in mind are cultural factors, alcohol or drug misuse, and family history. So I'm just going to briefly go through these because there's a lot of information, but if you think about mental illness, let's say depression versus physical illness like diabetes, you're talking both about illnesses. So one has to do with the brain, with the mental illness. One is the pancreas, so just different organs, and they both have hormone imbalance, just different hormone imbalances, and they both have just medical descriptions. And then they also have descriptions that people may talk about with their friends. A lot of the times, which is hopefully changing, is that people would describe crazy, weak, lazy, unstable, looking for attention as a mental illness. Whereas if you had diabetes, somebody's saying, oh, you're resilient, you're normal, you just can't eat sugar. So it's just important to think about our language and how we think of these differences, because they're both illnesses, just one doing with the brain and one with the pancreas.
So now we're heading into another component of our presentation, and that's understanding and identifying mental illnesses and their treatments. And this does contain a lot of information. We will be covering a lot of various elements, but keep in mind that you will have access to these slides afterwards. So the first topic that we always start to discuss with this is talking about stress. That's definitely something that is on a lot of people's minds. So we do want to talk about, actually, we're going to reframe our thoughts about stress and show how it actually can drive growth, and it can be something that can help with your overall performance. So we're going to show what we call an inverted U-shape relationship between your performance and the level of stress. So we're looking at, if you can see, low stress, poor performance. We've got poor performance, high stress on the bottom right-hand side. But what we're looking for is, you can see the moderate stress level with maximum performance. So we can really apply this to a lot of different areas in our life, whether it's your first job, whether it's trying to do well in school. Having a little bit of stress that's present can help with the performance. We can utilize stress to drive our growth and to drive us and kind of push us into new areas. When your body reacts and you feel butterflies, you might get tingly, you might kind of sweat. That's okay. That's your body's normal reaction to stress. That's a human reaction. We can never, ever avoid stress. And I'm always very clear. I work with a lot of students who discuss issues pertaining to stress. And I always say we can never avoid stress. You have to learn to deal with it within your life. We can never, ever lead a stress-free life, but what we need to do is develop coping mechanisms with the stress. So diving a little deeper into that, we're going to talk about three main types of stress. So the first one is positive stress. This is usually pretty brief, and it's going to lead to what I was talking about in the earlier slide, that growth, adaptation, learning new things. There can be negative emotion involved with this. If you're trying to learn how to give a presentation, the first time you did something like this, a Zoom presentation, you can have a negative emotion with it, but it is driving your learning and your adaptation to developing a new skill set. The second type of stress is tolerable. It can have a serious impact, temporary. However, if you have those supportive factors, supported relationships, coping mechanisms, that type of stress does become more tolerable. We will have that throughout our lifetime. It could be anything as, for me, I would say one of my tolerable stressors is my commute heading into work. It's something that I'm going to have to deal with. It does have some impact. It's got some serious impact on my time, but I have to learn how to kind of buffer that tolerable stress. The third type of stress is toxic. Now, when I'm talking about the growth and in the adaptation from stress, I'm talking about positive and tolerable. Toxic stress is what we consider to be prolonged, and it usually includes examples of extreme physical abuse, sexual abuse, chronic neglect, violence, mental illness, substance abuse. This will have a lot of complex outcomes, and that usually doesn't drive positive changes. So toxic stress is something that we would definitely want to address. Now we're going to talk a little bit about what we consider to be a typical stress response. So think about a situation or a specific trigger that you might have. For some people, it would be speaking, an oral presentation, speaking in front of a group of people, meeting new people. Maybe you're at a party, first day of class, trying out for a team, asking somebody out on a date or asking somebody out for a cup of coffee, going to your first therapy, first of anything. So that could be triggering for a lot of people. And you would probably develop some sort of a stress response, a physical response to that. Some of those examples would be, you might feel a little bit of trembling in your hands. Some people might even feel a little bit of nausea, tension, nervousness, sweating. Sometimes you don't even know that your body's doing it until afterwards. And you're like, whoa, okay, I felt that stress response. The outcomes from that, it is, like I had said before, it's going to drive adaptation to the stress. It's going to kind of push you into that learning zone, into that growth zone. When successful, it results in the learning of new skills, and the person does become more resilient. That is developing some resiliency factors. And remember, sometimes it does feel unpleasant. However, stress is nothing that we can necessarily avoid. We're going to turn it over, though. We're going to talk about anxiety versus stress. So we know that anxiety is what we call a state of hyperarousal. Your body is even at a higher level than just regular stress. So it could be a similar situation or a similar trigger, like I had mentioned before, meeting new people, giving a presentation, any sort of new situation. But also with anxiety, the difference is there may be no trigger. There may be no trigger that you can actually put your finger on and think, this is actually causing me anxiety. You may not know where it's coming from. It will have a similar stress response. Your body will feel similar things, that apprehension, nervousness, nausea, just a general trembling. The outcome, though, will be vastly different. It will be persistent, excessive, and inappropriate anxiety. And remember what we said, there could be no trigger, so you might not even know where this excessive anxiety is coming from. Causes impairment. And Carrie had talked about this before. If it's impacting your life and you're not able to do the things like go to school, have a job, that's causing an impairment in a person's life. It can lead to dysfunctional coping, and then it can lead to withdrawal and avoidance. So when a person completely withdraws from life and avoids any new situation, avoids people, avoids basically those day-to-day living. So we want to make sure that we're looking at anxiety because it really can impair our ability to lead what we would consider a healthy life. And then we're going to talk a little bit about what happens with that. So we've got a video, and I think Carrie's going to show that, and we'll unpack that afterwards.
Hi, my name is Morgan, and today I'm going to talk a little bit about anxiety. For me, anxiety feels like this absolutely dreadful feeling. It feels like something terrible is going to happen and that I can't really ever rest or be at peace. It's like it's always tugging on me and trying to get my attention, and I can't really seem to calm down. Anxiety has impacted so many different areas of my life. In the past, it used to impact a lot of my relationships, where I always had this lingering fear that people in my life were going to hurt and abandon me. And because of that, I felt like I always had to be in control. And when you're trying to be in control while building an authentic connection with other people, it really gets in the way. Those people really don't get to know you and who you truly are underneath those fears and that control. Anxiety has impacted my ability to rest and take care of myself. Because for me, a lot of the time, it's felt like other people are always ahead of me and that I always need to be doing more. And because of that, it's really hard for me to just relax and do the things that are going to keep me well and taking care of myself. I learned to manage my anxiety in a lot of different ways. And one of these ways has been through talk therapy, which has made a huge difference to say those fears out loud and have another person help redirect my thoughts into something that's more logical and more positive. Also, it's been really helpful to learn grounding techniques such as yoga, journaling, meditation, and even smelling something like essential oils. This has made me feel a lot more calm and a lot more in the present moment because anxiety likes to steal the joy of the present moment away from people. If I could go back and tell my younger self some advice when my anxiety was at its worst, I would really tell myself that those awful, intense feelings are temporary and they're going to pass. And those fears come from really valid places, but anxiety doesn't serve me. And by using the mechanisms that I've been able to develop by going to therapy, it's been able to bring me so much joy and peace in my life. Thank you so much for listening, and I hope this video was helpful.
So that was Morgan talking about anxiety, and there's a couple different types of anxiety disorders, but what to know about an anxiety disorder is that they're usually feelings of a continual or very extreme discomfort and tension, and they can include panic attacks. They usually are at a level where it's interfering with your life. So an anxiety disorder is characterized by, these extreme feelings or interfering with your life, or it's happening over and over and over. Anxiety disorders affect the way a person thinks, feels, and behaves, and if not treated, it can cause a lot of suffering. So it's important to know that they can begin in adolescence or early adulthood and may sometimes be triggered by some significant stress. So symptoms of generalized anxiety disorders. We all have times when we're worried, but anxiety disorders, again, they're persistent, excessive, and interfere with our lives. And they occur more than, usually at least 6 months. The individual finds it difficult to control the worry or let it go. The anxiety, worry, or physical symptoms cause significant distress or impairment in school, work, and/or relationships. And the anxiety or worry are associated with 3 or more of the following: restlessness, feeling on edge, or keyed up, difficulty concentrating or mind going blank, irritability, muscle tension, or sleep disturbance. So let's just review. Think in your head, true or false. All stress is bad for our health and should be minimized. That is false. True or false. Anxiety is different from more normal stress. It interferes with our lives. And that is true. Anxiety is very different than stress, and they're 2 different things. So is it stress or anxiety? Let's just review the differences. So for stress, again, generally is a response to external cause, or a stressor goes away once the situation is resolved, can be positive or negative, like Elizabeth talked about, drives learning, adaptation, and resilience and growth. Even if it's negative, it still can drive that learning, that adaptation. Anxiety usually involves a persistent feeling or apprehension or dread that does not go away, interferes in functioning, is constant, even if there's no immediate threat or no trigger, and it leads to withdrawal and avoidance. And then just to know, both stress and anxiety can affect your mind and body. Both can obviously feel uncomfortable. You may experience symptoms such as excessive worry, uneasiness, tension, physical pain, sleep, or appetite issues. So you can experience that with both anxiety and stress. And
So we're
this
going to watch another video, and this is focusing on depression. And there's a lot of really good information from this person's experience with it.
Hello everyone, my name is Sarika Agarwal and I am a young adult public speaker for an organization called Minding Your Mind, in which speakers such as myself share our own personal stories with mental illness and recovery. And today I'm going to talk to you all a little bit about depression. Now, depression is something that is extremely misunderstood. A lot of people may think it's just being a little sad for a few days and just kind of snapping out of it, but it didn't work that way. I remember depression feeling like this extremely deep sadness, and I felt like no matter what I did, I couldn't seem to pull myself out of it. I wasn't able to eat. I couldn't get myself to put food in my body. I wasn't able to sleep. I would stay up the entire night crying. I don't even know about what. And then because of that, I wouldn't be able to go to school in the morning. And then one day of no school turned into 2 days, and soon I was just rarely able to go. I had friends who would try to come hang out with me, but I couldn't get myself to leave my room. I just wanted to isolate, be in bed, be away from everyone. I used to care so much about grades and school, but then I would bring home a 70, a 60, and it didn't matter to me anymore. Nothing mattered to me anymore. I felt like I was in this hole, and no matter what I did, I couldn't seem to crawl out of it. And depression had such a huge impact on my life. Not only did it affect my grades and the relationships that I had with other people, because I started just pushing them away because of how I felt inside, but the biggest impact it had was the way that I saw myself. I just started to hate myself. And I just started to think that there was no way that I could ever be happy again. So what was the point in even living? But I am so extremely grateful to say that today I no longer suffer from depression. I was actually able to go to therapy when I realized that there was a label for what I was feeling and there was actually treatment for it. And by being able to go to therapy, I was able to start coping with my emotions better. I was able to understand where they were coming from. I was able to challenge some of those negative thoughts that I had. I was able to engage in behaviors that were promoting positivity in my life. And today I'm just so happy to have this life, because it's not that I don't feel sad. I do sometimes, but because I'm able to manage those feelings in such a healthy way and never let it get to the place it did before, not even close. And I know that if I ever did feel that way again, I would have so many things I could do and people I could go to that would help me feel better. So if I could have said something to myself during that period of time, I think what I would have said is, the pain you are feeling is no match for the joy that is coming. When people say it gets better, they really mean it. Because for me, it didn't just get better, it got spectacular.
So now kind of moving along after the information that she had provided us, we're going to talk a little bit about moods and symptoms. And we know that everyday stressors in your life, just living life day in and day out, we have a lot of different emotional states. Some can be negative, some can be incredibly negative, some can be positive. But keep in mind, we all have periods of sadness. We can all have a time when we're incredibly unhappy, frustrated, disappointment. We can even feel that for days, maybe even a few weeks at a time, if there's a certain situation that we've encountered. It doesn't necessarily mean that it is depression. And on the other hand, when we have those positive emotional states, elation, joy, excitement, it doesn't mean that we have mania too. Some people tend to be more prone to having more, feeling more excitement and being more exuberant about that. And it doesn't mean that it's a state of mania. So let's look at some of the common symptoms and signs of major depression. And keeping in mind that depression definitely looks different in teens and adolescents than it does in adults. As you're segueing into kind of what we call young adulthood, depression can look a little different. So what we look for, a sense of hopelessness, down or depressed mood for most days. You're also going to have a change in appetite, maybe a change in your sleeping patterns. You might sleep a lot more, you might sleep a lot less. There's also going to be an inability to concentrate and retain information. Whether you're a student, you're retaining new information, you're an employee, retaining the information for training in a new job, your overall ability, that overall cognition can be impacted. Another sign that we see is a loss of pleasure in those things that are usually found to be pleasurable. They don't want to hang out with friends anymore. If somebody enjoys running, they're not doing that anymore. If somebody enjoys playing games, they're not doing that. There's no pleasure to be had with that. Similar to the change in appetite and sleep, there's a fatigue or a loss of energy, just kind of an overall lethargy. Sometimes I've heard people say, I just couldn't even gather enough strength to get off the couch. You'll also see a social withdrawal. People will tend to isolate. They don't want to be around friends and families. We also will see physical symptoms. What impacting the body, the headaches, stomach aches. I've had students that have developed different kinds of twitches if they've been experiencing major depression. There's also feelings of worthlessness and then guilt because they're feeling so guilty for feeling this way. They don't understand why they're feeling this way. So then they have an incredible amount of guilt. And lastly, something that we are always on the lookout for is thoughts of death or suicide. So that's something that we always want to be cognizant of. So talking about depression and anxiety, two very or more common mental health illnesses. And so what do we want you to know about treatment? We do know that it requires psychiatric care and ongoing monitoring. Remember, thinking about that highest point on the pyramid, we know that ongoing monitoring, ongoing therapy, ongoing work with it is going to be the key. Medications may be necessary. Therapy, ongoing therapy is necessary. Modification of school curriculum may be needed to accommodate for the cognitive problems that occur with depression and anxiety if it's impacting you as a student or even as an employee if you're already working. Depression substantially increases suicide risk. So that's something that we're always aware of and we always want to be on the lookout for. Which then kind of moves us into what we call the elephant in the room, because a lot of people are really uncomfortable talking about that, and that's suicide. We know it's an incredibly sensitive topic, and we really do feel, though, having this conversation is very necessary. So, what are some of the things to look for with suicide? We're going to break it down into 3 different areas. We're looking at the emotional signs, mood changes, lack of interest in things, increased anxiety, irritability, and just a general sense of hopelessness. Some of the verbal signs, some of the things somebody might actually articulate: wanting to die, whether that's in an active way or in a very passive way. People stating, not being able to find purpose, not understanding why they're living. feeling like they're a burden, which then leads to feelings of being ashamed or humiliated. And oftentimes I've heard people say that they feel trapped, that they just don't have a way out. They're not quite sure what to do with the next steps. So now looking at some of the behavioral signs, isolating, when somebody is not really wanting to communicate with other people, when somebody starts to give their possessions away, that can be another sign that we would be on the lookout for. Incredibly reckless behavior, particularly if it's different than the way they would typically behave. We can see sometimes an increase in different types of behaviors, such as anger or aggression, and there often will be an increase in different substance use. So this isn't the total list. These are just some things to kind of keep an eye out. These are some of the more general things that we look for when we break it down into the emotional, verbal signs, and behavioral signs. So what do you do if you are suspicious that somebody might be thinking along these lines? Will asking someone about suicidal thoughts plant the seed? The answer is no. It will give them the opportunity to talk and get help. We cannot stress that enough. Never agree to keep a secret in this case. Affording them that opportunity to discuss how they're feeling, to let them talk about it, that's the key. So many people are waiting for somebody to ask them. If you are concerned, always ask and never agree to keep a secret. One of the new resources is 988. This is the new National Suicide Prevention Line. If you or someone you know is experiencing a mental health crisis, you can call that number, and it is an excellent resource. So the next slide kind of goes over what happens when I call 988. You'll get these slides, so we're not going to spend too much time on it, but you are connected to a trained crisis counselor who will be able to talk with you in the here and the now. And that's incredibly important if you or a person you love or a person you know is in crisis.
So after learning all about that, if you look at these two people, who was more at risk? A friend has consistently been canceling plans and has appeared a bit disheveled the last few times you've seen them. They mention that all they want to do is sleep and that nothing matters. This is the other person. You're at a party with your friend and they mention what a good week they've had. They got a great summer internship and won their championship game. They take a sip of their drink and joke about drinking the pain away and laugh. They're smiling and everything seems to be going their way. So the person who looks like they're okay and having a good time at a party sometimes can be the person that is suffering the most. You can't just assume if they're acting happy on the outside that that's what they're feeling on the inside. It's just easy for people to hide their feelings, and that's important to know as a friend or someone supporting them. Checking in is just as important as getting help for yourself. So the bottom line is that we just always need to ask if you're concerned. And so these are some facts for general education purposes. They're not meant to substitute for professional medical help. I'm going to gloss over these again because you're going to get this presentation. So if you're interested in learning more about one of these mental illnesses, you can go back to it, but it's a lot of information. And these are the more common disorders. So these are fast facts on anxiety disorders, and it will go through the generalized anxiety disorder, panic disorder, and the social anxiety disorder, and just some fast facts if you might feel like you want to learn more about this. Attention deficit hyperactivity disorder, ADHD, here's all the fast facts on that. Bipolar, depression, eating disorders, OCD, post-traumatic stress disorder, schizophrenia, substance use disorder. So those are all those that you can go back to. And then we're going to go on and be talking about obtaining and maintaining good mental health. So our first topic is going to touch on social health and relationships. So we all define success differently. I think these quotes are worth reading aloud. Arthur Brooks says, anything that substitutes for close human relationships in your life is a bad trade. You will sacrifice happiness if you crowd out relationships with work, drugs, politics, or social media. We love this quote, and it is backed by science, but it's just important that our values are important to us and that we don't substitute relationships with something like social media. According to one of the longest studies ever conducted at Harvard, the #1 predictor of longevity and life satisfaction is healthy relationships. So, you know, depending on our values and priorities, we're all influenced by, you know, things around us, but it's important to keep intact our relationships. Studies show that this is a really important thing in our life. And Elizabeth, you can jump in too, because I know you have background in this. So social health, a dimension of well-being that comes from connection and community. Many of us heard of physical health and mental health, but we don't hear about social health as much, which basically is the dimension of well-being that comes from connection and community. So belonging, a sense of community in our town, city, school, workplace, club. Connection, it's real connections with people, authentic connections with family and friends. And then this third piece is important because solitude is just as important to connect to ourselves and with others. The time spent alone is not the same as loneliness. And it's essential that we prioritize our social health with diligence. And these are the three main aspects of it.
And one thing I always add to the students and the young adults that I work with is we always look at quality of relationships over quantity of relationships. And definitely, particularly now in the times that we live in, there's a lot more people that are isolated than ever before. They're now likening loneliness to an actual disease. So it's something that we really should keep in mind. And that's not to say, just like what Carrie said, with solitude, that can be something that's incredibly essential for most people. Some people need a little bit more than other people, but that really is the time to connect and be comfortable with yourself and recharging in order to then have those connections with other people and develop your community and your sense of belonging.
Yes, and to piggyback off that, it's also important to understand the qualities of healthy relationships. Feeling seen and known, understood, and respected by somebody in a relationship is really key. Having fun together and sharing experiences, you know, celebrating the good and supporting through the difficult. You know, it's not going to always be perfect. Relationships can always be improved.
Mm-hmm.
But these are kind of the heart of qualities, good qualities. Setting and respecting boundaries and making compromises. Very important. Accepting each other as you are, not trying to control one another. Putting the other person first sometimes, but then also putting yourself first sometimes. Communicating clearly. Arguments are a place to solve conflict and not hurt each other. Arguments are okay, but right, not to hurt each other. And trusting each other. That's a healthy relationship when you trust each other, and appreciating each other and showing kindness towards one another. So these are, again, qualities. No relationship's perfect. You can improve on these. It's not going to be perfect all the time, but this applies to all relationships in your life. What to look for in an unhealthy relationship. Unfortunately, all relationships are not healthy. And these are just some of the warning signs for some abusive and unhealthy relationships. Possessiveness, extreme jealousy, trying to isolate the partner from others, taking them away from other friends or relationships, controlling partners' activities, communication, money, emotional abuse, intentional humiliation, excessive blaming and criticism, gaslighting, which is it's a kind of a form of manipulation, physical or sexual violence. So threats, that's also what to look for, and if they're threatening you. Anger, especially if alcohol and drugs are involved, and a cycle of abuse. Like can be a pattern of honeymoon phases in between very volatile phases. It's just confusing. So what do you do about an unhealthy relationship? If you're worried about someone in an abusive relationship, here's some of the things you can do to help. Be a supportive listener, validate the person in an unhealthy relationship, focus conversations on the person and their experience in the relationship, not the relationship itself. I'm so sorry this is happening to you, not labeling that relationship as bad, because you don't want to isolate yourself from that person. You're supporting them. You want to be careful about pointing too much out, and more being a support so that they know you're just there for them and listening. Don't try to convince them to leave. This may cause them to stop communication with you about the relationship. Do offer your concrete support. What can I do to help? And then obviously offer the resources and community, their resources and supports to help you. I'm here to help you connect with them. And then always tell a trusted adult, whether it's for you or someone else, if you're really worried about abuse. And these are just some places you can go. So the next topic would be social media. This is important to realize, that social media is not reality. We really can't compare our lives to like the highlight reel of someone else's, because we have no idea what that person's feeling just based on what they post in a perfect situation. And one thing that is helpful is to clean out your feeds. Ask yourself, are your feeds filled with negativity or bad news or perfect looking people? Are there a lot of people who follow that we don't actually care about? So just take some time to clean that out and make it positive. And then lastly, how much are we using social media? It does say that research shows 2 hours a day is a good, 2 hours or less a day is a good benchmark. Scrolling endlessly for hours instead of spending time with friends, just ask yourself that question. And how we're using it matters the most. You want to increase your connections with people and avoid the scrolling on social media. So this is just a little rapid reflection, and it's to understand that this can change a lot, but it's important to think about who your go-to people are. Like, we need those people to lean on. Who are your people that you can depend on, that you can go to when you really need support or you need help? You can think about these in your head, or if you have a piece of paper, jot them down. If you have a little notebook, and again, these people can change, but it's key to have some go-to people.
So now segueing into another section that's definitely applicable to a lot of young adults, a lot of people in this time in your life, and that's transitions and resilience. So we're going to take a deeper dive into that. So in doing so, we're going to take a look at what your values are, what your own personal values are. There's no right or wrong. This is kind of just for you to do some self-exploration. So when you kind of think, how do I know what my values are? You're going to want to ask yourself, what is most important to me? When I picture my ideal life, what do I see, whether that's currently or what you see in your future? What activities bring me the most joy or, and this is key, sense of purpose? Then think about it a little further, and you want to come up with the list of your top 5 values. It could be things pertaining to community, creativity, what's going on with your family. Maybe financial stability is one of your top 5 values. Friendships, cultivating friendships, meeting new people. Maybe your overall health is going to be one of your top 5 values. Maybe personal growth, education, continuously learning. I have a friend that just got her doctorate degree and she is in her 70s. So one of her top 5
My gosh,
values
it's
is
amazing.
definitely, I know it is amazing.
Wow.
Never too old, but that's definitely one of her values, is just continuing on that growth path. And there's no right or wrong. You kind of choose what's important to you as a person. And as you're in this young adult phase, you're really starting to make note of, what are my values? What means a lot to me? So I'm going to do another rapid reflection like what Carrie had just done. How can your values inform the decisions that you make in young adulthood? So what's going on in your life right now? How are your values informing your decisions? How do they affect currently how you're spending your time, your money, and your energy, whether that's your physical energy or your mental energy? How are your values guiding you as you kind of navigate this world post-high school, maybe into college, post-college? How are they prioritizing what you want to do in your life? So just kind of think about that. Those are always good questions to continuously think about and evaluate. So now, stepping into transitions, we know that there's a lot of transitions in a young adult's life. Recent grads that we've talked to over the years have commonly felt some of these things, so that you're not alone. So as we talk about this, we've heard statements, I have no friends and I don't connect with anyone here, whether it's a new college you're going to, a new city that you've moved to, a new job. I wish I were back home where I was comfortable. We love being comfortable. We go back to stress that can be growth inducing, but it can also be very uncomfortable to go through those situations and meeting new people and being in a new location. Another thing we hear very often is, I don't know what I want to do with my life. And if you were a student that I was working with, I would say that's okay. Most people don't know what they want to do with their lives, and you will have many different changes throughout your life. And it's okay to sit with that uncertainty.
Well, and it's okay to get your doctorate at 70 years old and change your mind.
Absolutely. Absolutely. Usually the progression isn't linear. You'll have many zigzags along the way, and that's perfectly okay. Things are so different, whether it's work, classes, life on your own. There can be different types of stress. It's just a very, very different feel from even when you're 21 to the time that you were 17. We hear often from young adults, they miss their old life. They miss their friends. They miss their family. Even if they've said things like, oh, my family can be so annoying, they end up missing them and just having the close proximity to them. And oftentimes we'll hear, will I ever feel okay again? And we just want to assure you, this is a normal part of this stage in your life. These transitions are normal. This isn't something that's easy. You're really going through a lot, and it's happening in a pretty condensed amount of time for a lot of people. But we are here to say, as you're going through the transitions, kind of segueing into developing that sense of resilience. As the definition here says, resilience, the process of adapting well in the face of adversity, trauma, tragedy, threats, or even significant sources of stress. So when you are developing your own sense of resilience, your own self-resilience, you are able to change, you are able to move through these rapid changes that go on in your life. And it can be a difficult thing. It can almost be, I don't know if it's necessarily a learned trait, but we really need to dive deep into the idea of resilience and how that can benefit you in most stages of your life. So we're going to take you on another self-reflection exercise. So, and once again, there's no right or wrong answers. Just take a moment, think about what your top 5 stressors are right now as you're watching this presentation. So what are those top 5 stressors? They're probably a little bit different than they were 5 years ago. And they're probably different than what a top 5 stressor would be down the road after you've started a career, after you've started a family. So take that and think about, what are your top 5 coping mechanisms? What are you doing when you're feeling stressed, when you feel the stress coming on? What are the things that you're doing most often? And then you want to say, are these healthy or unhealthy coping mechanisms? So this is, judgment-free zone here. We're not here to lecture and say, oh, you should do this, you shouldn't do that. You probably are aware of what is a healthy coping mechanism and what's not a healthy coping mechanism. And we're all human. We've all had unhealthy coping mechanisms before. The idea, though, is you want to definitely hold on to those things that you know are healthy, that can help with your coping and help develop that resilience. It really can be developed. And so look at some of those things that are healthy. Look at what others around you are doing that might be healthy mechanisms that you might say, you know what? I might want to give that a shot. I had a student that said, oh, I would never do yoga. What a waste of time. When I work out, I need to sweat. I really need to do stuff. And guess what? They tried yoga and they realized, wow, I've actually slowed down and it's just increased my overall health. So you would say they've developed a new healthy coping mechanism. Which, let's talk about overall strategies when the going gets tough. I would actually say, instead of overall strategies when the going gets tough, we really could say overall strategies that you should just be using in your life. So even when things are going well, and also when things are going tough, these are things that you really should start to develop. Keeping a routine, consistent sleep, exercise, meals, meditation. You know what you need. Do you need 4 meals a day, 4 small meals a day? Do you prefer 2 meals a day? You know what works for you, but keeping that routine, keeping a consistent sleep schedule as much as possible. We all know what we're like when we haven't had enough sleep. We're not even really sometimes able to think rationally, and that can be pretty detrimental. Next, exercise empathy for yourself and others. I've heard from people often throughout the years that it's really easy to be empathetic for others. But when you learn to develop empathy for yourself, when you learn to say, that's okay, it's okay that I made a mistake, I'm just trying the best that I can, that can really go a long way, learning to develop it for yourself. Next, and this is really hard for a lot of people, myself included, plan what you can and let go of the uncontrollables. There are many aspects of our life that are uncontrollable. We can't control what other people are going to do. We can't control what the state of the economy is going to do. We can't control when there's going to be an accident on our way to work, so it could impact our commute. But when you're able to plan certain aspects that you do have control over, that can really help your mental outlook for those areas that you don't have a lot of control over. Next, accepting imperfection. We live in a social media day and age, just like Carrie spoke about before. And if you looked at everything on Instagram or on social media, everybody looks perfect. Every imperfection has been taken away from maybe some of the people that we follow. I'm sure a lot of our friends are only putting out perfect images on social media. So it's really hard to go back and just understand that most things are not perfect, and accepting it the way it is can be incredibly beneficial. Expressing gratitude, knowing what is going well, incredibly important. Our minds are designed to notice what is negative. We focus more on the negative. That's human nature. When we read reviews, we're going to go towards what are the negative reviews? What is this person saying? What is this person saying on social media that's negative? That's going to draw you in more so than something that's positive. At this point, if we can just notice what's going well more often, it will be incredibly beneficial. Staying connected and present. What does that look like to you? Does that mean when you're going out with friends, you all put your phones down at a table and make eye contact, have conversation? You're connected in the here and the now. You're present. You're not looking at something going on your screen. Start developing those ways to stay connected and present and figuring out what that looks like for you. For me and for my family, it means that we never ever bring any devices to the dinner table. We talk, we have conversations. We try to be as present in the here and the now as possible. Prioritizing healthy fun and laughter. That is just good sense, right? Who doesn't love to just laugh? Who doesn't love just having a good time? Make sure that you're fitting that into your life. And lastly, and this is hard for our society specifically, asking for help and leaning on support networks. Our society is taught that we're supposed to be independent. We're supposed to be able to do these things on our own. That's not always the right way, though. We need to be able to be comfortable asking for help, asking for support. Carrie and I had to ask for help tonight when we were getting this program up and running. We had a bit of a technical glitch, and so we had to reach out and ask for help. And we were both okay doing that.
And a 17-year-old was way better at technology than we were.
100%.
Or 18 maybe.
So now we're going to do an exercise. I think we have time for this. It's called box breathing. So I'm going to walk you through this. This is something that's incredibly easy to do. And for a lot of the folks that I work with, they really enjoy very simple breathing exercises, and just to kind of calm them, get yourself regulated, get your brain focused in the here and the now. So this is very, very simple. You can try this on your own. You can do some sort of a component of this. So what I'm going to have you do is sit and close your eyes. You're going to visualize a box with 4 equal sides. You're going to be sitting in a comfortable position, and you're going to breathe in for 1, 2, 3, 4. You're going to hold your breath for 1, 2, 3, 4. You're going to breathe out 1, 2, 3, 4. You're going to hold for 1, 2, 3, 4. You're going to breathe in for 1, 2, 3, 4. You're going to hold for 1, 2, 3, 4. You're going to breathe out 1, 2, 3, 4. So that was just one sequence. And it really slows your breathing down. It kind of slows down your mind, allowing that focus and the ability to concentrate. You can go through as many cycles as you would like. And some people I've spoken to have similar breathing exercises like that, or they might do other sorts of visualizing meditative exercises, but all of them work very well and can be an incredibly positive boost to our overall mental health.
Yeah, and you can really do this anytime and anywhere without people knowing. It's for transitions, really for any reason.
Absolutely. I've also spoken with people that have some stress in their lives or anxiety, and if they feel their body reacting to that, they've been able to do this. So that's really helpful. So now we're going to go into just a quick slide. We're going to talk about it briefly, and it's called building balance. So kind of looking over your life and looking at the different aspects of your life. We are all juggling a lot, and we know that kind of balancing everything in your life. It's an ongoing process. Some weeks you might be putting a lot more into your work. If you've got a big project, maybe you're in school and you're doing a lot of finals, end of the year stuff. So you may be the scales might be tipping more towards work. Maybe you're going through something a little difficult with friends or family, so the scales might be tipping more in the family or the emotional health. But what you want to do when you're building your own sense of balance for yourself and what works for you, take a look, like this circle indicates. This isn't an exhaustive list, by the way. Look at the different aspects of your life and what can you do to build out different types of balance. What can you do for your social health, for your physical health? I know for me, one of the things that I do just to kind of incorporate some balance into my life is I do a lot of walking and I do a lot of running. Sometimes if I have time, I'll do a quick swim. But balancing out that physical health is incredibly important for me for the overall balance of everything. Making sure that I'm spending adequate time with family. Some weeks, it's definitely going to be quality over quantity of time that I've spent with them. And I'm here to tell you, it's taken me many, many years to make sure that I'm balancing my work level in my life and making sure that at certain times, I'm not checking emails, I'm not responding to something. So making sure that I'm balancing out all those aspects. And it's a work in progress. And some weeks, you may feel like, hey, I've got this. And some weeks you might not, but just take it one step at a time and find out what works for you and what feels comfortable for you. So we're talking a lot about different aspects of our life. And one thing that we want to keep in mind are we all have various protective factors. And it's incredibly important to kind of look at those and figure out, hey, what do I have? What are some of my own protective factors? So when you look at your own individual factors, take a look at your physical health. That would definitely be a protective factor if you feel as though you've got some strong physical health. Your values, are you following the value system that makes sense for you? Have you developed a good sense of self-compassion? What do your coping skills look like? Are you developing strong coping skills? Think about your self-esteem. Do you feel confident in yourself? Do you feel as though you know who you are? Those are all examples of individual protective factors. Now let's take a look at some broader based social factors that are protective factors. Are you feeling success in different areas of your life? Is there some particular area in work or school that you feel success in? And I know in this day and age that can be a tricky statement, because I know a lot of the students I've spoken to feel very, very pushed to be high achieving. So stepping that aside, what is it that you enjoy and you have experienced success? And it could be something that has nothing to do with being the most high achieving student academically, but that sense of success that you might feel in various aspects of your life. Are you receiving encouragement from friends, from family, from people around you? Do you have healthy relationships? Once again, it's quality, not quantity. Do you have a sense of belonging wherever you are? And then the protective factors, kind of broadening it even greater, would be those environmental factors. Are you able to access your basic needs? We always say, whenever we go into big meetings with the students I work with, we always say, okay, make sure your biological needs are met. Make sure you've utilized the bathroom if you need it. Make sure that you're not hungry. Make sure that you've got water. So kind of some of those environmental factors. Do you feel safe? Are your economic needs met? Do you have your basic medical needs met? So those are other examples of kind of those broader based environmental protective factors.
So we're coming on to our last topic, enhancing help seeking efficacy. We often get asked, how can I help friends who are struggling? It's important to know it's not your responsibility to help. You can support instead. It's not possible to help if they don't want help at all, and you're not trying to fix anything. You can't fix their distress, but you can support. One of the ways you can do that is to be checking in with them and validating their feelings, seeing how they're feeling, being a supportive listener. Just check in with them. Do you need anything? How can I do to help? Ask if there's anything you can do to help. I love to cook, so if it can be something as simple as cooking a meal for somebody who really can't do that when they're in a hard, stressful time in their life. And then, of course, encourage professional help if they haven't done so already. And always tell someone else if you're worried about suicide. That's just kind of something you have to do no matter what. If you're worried about suicide, it's always better to tell someone, because it's something extremely serious that they won't be mad at you in the end if you tell someone. So what does mental health treatment look like? There's a lot of different treatments. I'm not going to go through all these, each name for them, but there's different types. So there's psychotherapy, there's different medications, and then there's other treatments like clinics, accommodations at school or work, or supplementary treatments like yoga, meditation, diet, change, socialization. So there's a lot, just depending on the person, a different treatment for each person. And then again, you'll have these slides, but this is where to access treatment. There's a whole list here. And in Hopkinton, where to access treatment. And here's our Hopkinton list.
Okay, so kind of going back to the beginning and what we had said that we were going to talk about. So kind of a quick review, talking about the four basic components. So the takeaways: mental illness is a clinical illness. The language that you use when you're discussing it, it really does matter. Remember, that was one of the things that we were talking about with reducing the stigma, and the language we use can help reduce the stigma. Signs and symptoms vary greatly, but they will interfere with life. Always seek help if concerned. And we talked about when basic living skills when it's interfering with some of those basic living skills, we know that there could be a problem. So seek help if you are concerned. The third area, self-care, is not an option. Going back to the basics makes a big impact. You have to take care of yourself. It's not a luxury. It's not an option. And it can be some of those basic things that we mentioned, making sure that you're sticking to a sleep schedule, understanding what your dietary needs are, making sure that you're present and socializing, making sure that you're developing that community around you. Even if it is difficult, those are incredibly important self-care pieces to consider. And treatment works, help is available. Treatment certainly does work. And Carrie had just mentioned different types of treatments. So, usually it's in combination with different things, and it does work. Help is out there, and that's why we'll be providing you with this information afterwards to make sure that you have that at your fingertips. The learning objectives. I'm pretty confident, I think Carrie's pretty confident that you're able to walk away from watching this, we think, incredibly important video, and you will have learned strategies for healthy coping and self-care, how to recognize the signs and the symptoms of mental illness, when professional help is needed, so when to get that professional help, how to develop healthy relationships, how to manage transitions during this specific stage in your life, and how to design a fulfilling life as you move into independence. A very exciting time in your life, and it can be overwhelming, but we want to make sure that you are as fulfilled as you can be as a young adult. So with that, we ask that you take a moment to fill out this evaluation form. We really do look at this information closely, and it helps us as we plan different events, and with the people that we work with, we really look into this. We'd also like just to take a moment to thank you for taking time to listen to this. Oh, and lastly, You can
Oh, yeah,
post
there's also
any.
the anonymous, right, questions
Yep.
form that if you, and those will be answered, you know, we will see them and they're anonymous. So any other questions you have, we're happy to answer.
Absolutely. And thank you very much. You've got our contact information, mentalhealthcollaborative.org. You can reach out at any time. We're on Instagram and Facebook. And I would just like to say I appreciate you watching this informational video.
Yes, thank you so much.